Welcome to Growing Younger Health and Fitness podcast designed for people over 40. Hello guys, and today in this podcast we're going to talk about the most common cause of back pain in people in their 50s and how you should adjust your exercise fitness routine in order for you not to aggravate your back pain. So this is Alex Blazewski here, physio from Growing Younger. So this will be the topic of today's podcast. So what is the number one most common source of back pain in people in their 50s? And that is degenerative disc disease. So that's sort of a bit of an umbrella term which actually covers a few different injuries, but essentially it involves your intervertebral discs or the little cushions in your spine, particularly kind of closer to the lower end of your back. And so these discs, they are subject to wear and tear over your lifetime. So by the time you get to your 50s, chances are you will have at least some degree of wearing out in the area. In fact, according to radiologic studies, pretty much everyone after the age of 40 has got some degree of wear and tear in their discs. Now, in most cases, you may have wear and tear, but it causes no pain, so you wouldn't even know about it, okay? Now, in something like 5% of adults with wear and tear in the discs, it will actually manifest itself in some degree of pain, okay? So let me just first of all talk about who is particularly at risk of painful disc degenerative injuries. So number one is you may get an acute injury. So you might have a fall, you may lift a really heavy object without kind of doing it with the right form, the right technique. So that will cause an acute, possibly a disc bulge, which then can cause pressure on the nerve, so that that can cause a sort of a sudden injury. Now, if you are carrying extra weight, particularly if you're sort of in the obese category, you are definitely putting yourself at a higher risk of sustaining a disc-related injury. Unfortunately, women are also more prone to getting disc-related back pain as well. Also, if you're a smoker, and if you have a very heavy, physically demanding job, so like if you're a construction worker or a plumber and you have to lift heavy things on a regular basis, then you're also potentially putting your back at risk. So I'm going to just quickly cover what kind of symptoms can you expect when you have a disc injury. Okay, so you will often get lower back pain. Now, quite often it will be more kind of one-sided. So a lot of the time, discs will tend to be a little bit one-sided. So chances are you probably will have pain either kind of more on the left or more on the right. Now, on occasion, you may have it sort of across the whole lower back. It can happen as well, but more likely you'll have it on one side. Now, the episodes of back pain, they will probably go from anywhere between they might last from a few days to weeks, and if it's really serious, even a few months. Okay. Now, the most severe ones may possibly require surgery. There's a surgery called discectomy where they cut the sort of the bulging part of the disc out to relieve the pressure on the nerve. So again, like certainly not everyone will end up doing that, but the most severe cases may have to undergo surgery to make things better. Now, the thing about disc injuries is, especially if there's a prolapsed disc or like a bulging disc, it may start to press on one of your nerve roots or the little nerves that travel from your spine into your legs. And that may cause pain in your legs. It may cause numbness or tingling. Usually affects one leg, not both. Okay, so if you're getting pain on one side of your lower back and then that sort of you've got associated tingling, numbness, pain in the same leg on the same side, then potentially you may have a disc injury. Now, look, I'm not suggesting you self-diagnose at all. It's just general information. You should definitely always go and see a doctor or physio to get a proper diagnosis, but that just kind of gives you a bit of a general idea of what to expect if you were having a disc injury. Um, and the next thing is sort of the things that make it worse, right? So it varies. It definitely varies from person to person. But as a general rule of thumb, if you have a bulging disc, usually sitting down for long periods of time is worse. Okay, so if you're sitting down, especially if you have an office job, you may find that sitting at the computer is going to be aggravating. So bending down to pick things up from the floor, for example, if you were to, bend down to tie up your shoelaces, quite often people describe that kind of movement is very, very difficult or painful. Lifting, I mean, again, depending on the severity of your disc injury, some people struggle to even lift a very light weight. And also twisting. So twisting, like turning around to try and like look behind your back, that kind of thing, may also cause aggravation of your pain. Um, Now, I'm just going to explain what actually happens in your back when you have a disc injury or disc bulge. Okay, so I'm going to use an analogy. Okay, so I always talk about just imagine a car tire. Okay, you've got a tough layer on the outside, which is your rubber, and inside you've got air. Okay, so it's in a very general way. Um, you can think of your discs in the same way. So you've got a very tough outer layer, and then you've got inside the disc, you've got gel. It's sort of like it's a very a moldable, rubbery kind of substance, and that substance can deform quite easily. Now, with degeneration of your discs, you may get like a tear or a crack in the outer layer of your tire or your disc, and that gel substance can actually protrude or herniate through the crack in the outer layer. So you get like a weak point in the wall, and the gel will start to protrude through that opening. Now, a lot of the time that bulge can return to its normal position. Sometimes, if it's gone really far, then pretty much the only way to reduce or to make it better is to have surgery to cut that bulging part of your disc out. Okay, so hopefully that analogy kind of makes a little bit of sense. And now on the outside of your disc, you've got, as I said, you've got a few nerves passing by. So if your bulge is big enough, it starts to press on one of those nerves, and it will cause, as I said before, it starts to cause pain and tingling in one of your legs. So generally speaking, if you are getting lower back pain and you're getting pain, tingling, numbness in one of your legs, it's definitely a good reason to go and see a health professional. Okay, so don't just rely on this advice in this podcast. You should be speaking to a health professional and diagnosing it properly. Now, I'm going to just last thing we're going to cover is, so if you do know you have a bulging disc or degenerative disc disease, how would you modify your fitness routine? So in the vast majority of cases, you should not be stopping your exercises completely. Okay, so if you have a fitness routine that you usually do, you just need to change it. You need to alter it, but don't. In the vast majority of cases, you should not be completely giving up on it. Okay, so number one is you should try and eliminate anything that involves bending over through your, particularly through your lower back, through your hips. Okay, so an exercise that I'm thinking about, especially if your pain is reasonably bad, you should be avoiding deadlifts. Okay, so deadlifts, if you're not sure if you know, but deadlifts involves sort of bending forward and bending through your hips and kind of hinging through the hips. And I know there will be some people who will say, well, if you have the right technique, it should be okay. Look, in my opinion, in my experience, even if you do it correctly, it still places a certain amount of stress on your lower or lower lumbar discs or the discs in your lower back. So I would just avoid that exercise altogether. So anything that involves bending forward, I would be extremely careful with. Okay, and if you do decide to do it, just make sure you use a very small weight to start with, just to test it out. Now, another exercise I'd be very cautious with is anything that involves twisting. Okay, so twisting through your midsection. So an example of that kind of exercise would be Russian twists. Okay, so if you're not sure what Russian twists are, you can you can try and YouTube it. It's basically lying on your kind of on your back, on your hips, and then you're just turning your shoulders from side to side. Sometimes you use an extra weight. So it's a good example of an exercise that I would definitely suggest you don't do when you have a disc injury. And generally speaking, just be careful when you're lifting weights. You may still be able to do some weights, but just be careful. If you, let's say, if you knew before the injury that you could lift 50 kilos, then try go. I would suggest going down by about at least 30%, and then trying it there. And then as long as it's not painful, then you can slowly, little by little, increase it. Okay, but just be very conservative. Try a much smaller weight than you used to be able to do, and then gradually take it from there. Okay. Look, when it comes to exercising, I would probably be seeking advice from a physiotherapist, just so they can give you kind of more hands-on approach in terms of like what you can and cannot do in terms of your fitness exercises. Now, one more suggestion I will make about your fitness routine, especially if you're working out in the gym. So whatever exercises you decide to do, try and keep your body in an upright position. So if you're standing, stay standing. Don't, as I said, don't hinge forward. Don't bend forward. Try and keep your back straight. Okay. Ideally, try as many exercises as you can. Try do it lying down. Okay. So if you lie on your back flat, it's generally better. So things like kind of like chest presses in the lying position, would probably be a better choice than trying to do something similar in sitting or standing. Okay. Or another example, say if you're doing your tricep, if you're loading your triceps, maybe like a skull crusher exercise where you lie down on the bench and you kind of you lower the weight above your head. So you may need to watch the video to know exactly what I mean. But pretty much all you need to know now is like pretty much need to try and choose the exercise that you can do lying down. Okay. So yeah, hopefully that clarifies a few things when it comes to lower back pain in your 50s, and especially when it comes to your lumbar disc injuries. As always, if you find that this video is useful and if you know someone who is suffering from lower back pain, feel free to forward this podcast to them. Hopefully it helps them as well. Otherwise, you can comment on this or find us on our Facebook page, facebook.com/growing younger program. All right, all the best for now, and I will speak to you in the next video.
Okay, guys, so I hope you found the podcast of value. If you did and you're struggling with your own health and fitness journey, there's a link in the description for a free discovery call with me. And that free discovery call, we're going to cover off a little bit about you, your history, your goals, what you want to achieve, and maybe we can help you or not with your own health and fitness goal. So if that does sound like something that you'd like to do, then click on the link in the description, and I look forward to chatting to you in the very near future. Have a good day, guys. Bye-bye.